All right, so first off, we have the sternum, which is located here between the midline of the anterior chest wall. Then we have the manubrim, this area, which is the superior portion of the sternum. The body, located in the middle and the largest portion of the sternum, here. His xiphoid process in the inferior portion of the sternum, located right here. And the sternal notch, up here. His clavicle, as you can see, is located right through here. It's the first third, second third, and third of the clavicle. That's good. Very good. So here we have the scapula located between T2, which is right here, and T7, right here. All right, we have his vertebral border located on the medial side of the scapula. His inferior angle, right here. And then the axillary border, which is right on this part. Axillary border meets the inferior angle, right along here. Here, turn this side, is a acromion process. It is the flat broad expansion of the spine of the scapula. Here we have his spine of his scapula, located right along here. And then the superior angle along the edge of his spine. And then turn around for me. His coracoid process, located right there.
Now we have the upper trap, or the upper trapezius. Insertion points are here. Origin points are here through here about. And then the insertion point is going to be up here at the acromion process. Then we have the lower trap. The origin is the spinous processes of the middle and lower thoracic vertebrae, so along here, and its origin point is going to be at the base of the spine of the scapula, so around here along the underside of it. And then the middle trap is going to be the spinous processes of C7 to T3, so about from up here to about here. And its insertion point is going to be the medial aspect of the acromion process and the spine of the scapula. So here's the medial of the acromion, and then that's also part of the spinous, towards the lateral end of the spine of the scapula. Alright, so all the movements of all the trapezius muscles are shown in abduction. So right here you can feel his upper trap helping the scapula move into upwards rotation. And then his lower trap you can feel as well, pulling it up this way. And then the middle trap go ahead, do it again. And go ahead and lower. It's helping with scapular retraction. So the rhomboids, insertion points are on C7, so about right here, down to about T5, which is right here. And then they insert on the vertebral border of the scapula between the spine and the inferior angle of the spine. So all through here, and they come in and then like cup on the vertebral border of the scapula. And it helps in scapular retraction, elevation, and downward rotation. To show retraction, pull your shoulder back, straighten, and you can do it again, and you can feel the rhomboids contracting the scapula like that. Right, stop. Alright, and then we have serratus anterior, and its origin is the lateral aspect of the first 8 ribs, so basically it's starting almost up here and coming down to about here. And then its insertion point is on the anterior surface of the vertebral border of the scapula, so about here. And then that helps with scapular protraction, so protract out, and then you can feel the pull of the serratus anterior. Stop. Alright, so we have the humerus up here. Now we have the greater tubercle. Just drop a little bit lower, and there's a ridge right there where the greater tubercle is. Then you have the lesser tubercle, about right in there. Then you have the deltoid tuberosity, which is right about here. Go ahead and lower. So right in there. And then the bicipital groove. It's about right in here. Where the bicipital groove is. Next
Okay.
up.
So we have the anterior deltoid. The origin is the lateral third of the clavicle, so here. And then the insertion, go ahead and flex, is the deltoid tuberosity. And this muscle is used in flexing, go ahead and flex, and abducting. All right, finish. So we have the middle deltoid, which is starts origin at the acromion process, and its insertion is the deltoid tuberosity here. And so this is the primary mover in abduction. So he abducts, the middle deltoid is causing that motion. The posterior deltoid origin is at the spine of the scapula, right along here. And its insertion is again the deltoid tuberosity, go ahead and turn for me, right along here, and is the primary mover in shoulder abduction, extension, hyperextension, and horizontal abduction. Abduction, yep, there we go. Yep, finished. Supraspinatus muscle. Origin is the supraspinatus fossa of the scapula, and its insertion is the greater tubercle of the humerus. Its muscle action is primary shoulder abduction, and also contributes to stabilizing the head of the humerus in the glenoid fossa. Finish. So, the coracobrachialis muscle, its origin is the coracoid process of the scapula, located in the scapula. And then, turn back around please. Its insertion is the medial surface of the humerus, near the midpoint of the shaft. So we're talking, it's going to probably be around this area, and it's going to wrap around up under the arm here. So it's going to come from here up over. Go ahead and cut. Now we have the latimus dorsi. Its origin is the spinous process of T7. So roughly around this area, you have scapula here, shoot around here to L5. It's going to come down to here. Then the insertion is the medial groove of the bicipital humerus. Now, it's important, this muscle here kind of comes up and wraps. Can you reach your arm up? So it's come up and wraps up around here. You can kind of see it move right through there. It's a primary mover of shoulder extension. Go ahead and extension. You can see it kind of working back there. And then medial rotation and add adduction. So come back to the body. Yep, right there. Ready? Start.
Yeah.
We have our guy in the prone position, and we're working on his teres major. Its origin is the axillary border of the scapula near the inferior angle, so right here next to his armpit. And the insertion is the crest of the humerus, just inferior to the lesser tubercle. So his lesser tubercle is kind of hard to see right here, but it's going to be about in this area. And so it's near the insertion of the latimus dorsi. And latimus dorsi comes around this area, so you got to think it's about right there. And it's the primary mover of shoulder extension, medial rotation, and adduction. Stop. So now we have the infraspinatus muscle. Its origin is the infraspinatus fossa, and its insertion is the greater tubercle of the humerus. It's going to be right up here, and it is the muscle action, or its primary mover is the lateral rotation, horizontal abduction, and assistive for extension. So he's going to extend like down. Okay. He's minor. Its origin, again, like its predecessor, is the axillary border of the scapula, So we're talking right along here, near his armpit, and its insertion, the greater tubercle of the humerus, right up in here. So cover that little spot right there. It is muscle action is a primary mover of lateral rotation and horizontal abduction, abduction. Okay. So we have the patient lying supine. All right, his subscapularis
Supine.
is his anterior surface of scapula. So it's kind of hard to see, but his scapula is going to be right up in here. And the lesser tubercle of the humerus, which would be back in here. And its primary action in medial rotation. Okay. All right, now we have the pectoralis major, the clavicular portion. It is located, the origin on its medial of the 1/3 clavicle. So here, his clavicle is right here. The 1/3, medial 1/3, and the lateral lip of the bicipital groove. So it's gonna be his bicipital groove is about here. It's gonna be on that lateral side, which is farther away from the body. It is the primary mover of flexion to 60 degrees with sternal rotation. With the sternal portion, it contributes to adduction, medial rotation, and horizontal adduction. And so now we have the pectoralis major, the sternal portion. So the origin is the sternum and costal cartilage of the first 6 ribs. So here we have his sternum and the costal cartilage, which is located right next to the sternum. And its insertion is the lateral lip of the bicipital groove of the humerus. Just like the clavicular portion, it's kind of up in this way, on the lateral side. Its primary action: shoulder extension and the resistance and against resistance of gravity or other force of full flexion of 180 degrees to about 120 degrees. The clavicular portion contributes to adduction, medial rotation, and horizontal adduction.